From Bowling Green State University and the Institute for the Study of Culture and Society, this is BG Ideas.
I'm going to show you this with a wonderful experiment.
You're listening to the Big Ideas podcast, a collaboration between the Institute for the Study of Culture and Society and the School of Media and Communication at Bowling Green State University. I'm Jolie Sheffer, Professor of English and American Culture Studies. As always, the opinions expressed on this podcast are those of the individuals involved and do not necessarily represent those of BGSU or its employees. Bowling Green State University and its campuses are situated in the Great Black Swamp and the Lower Great Lakes region. This land is the homeland of the Wyandot, Kickapoo, Miami, Potawatomi, Odawa, and multiple other indigenous tribal nations, present and past, who were forcibly removed to and from the area. We recognize these historical and contemporary ties and gratefully acknowledge the contributions of indigenous communities to this land. Joining me today are Dr. Justin Rex and Dr. Nicole Fifer to discuss the importance of community support and social networks in promoting well-being during pregnancy and early infancy. Dr. Rex is an associate professor in the Department of Political Science and a research fellow at the Center for Regional Development at Bowling Green State University. In fall 2023, he was an ICS Faculty Fellow. He joins us today to talk about his ICS Faculty Fellowship research project on racial disparities in infant and maternal health in Northwest Ohio. Dr. Nicole Fifer is the director of the Center for Regional Development at BGSU. She's an experienced analyst, program evaluator, and project manager. Her work at the CRD focuses on issues surrounding community health and well-being and public and social services. Justin and Nicole have collaborated on a project called Community Health Workers, Stress Reduction, and Racial Equity in Infant Vitality. Thank you both for joining me today. I'll start with you, Justin. Can you talk a little bit about this current research and how this developed out of your previous research that you've done?
Sure. I've been involved in a lot of community-based and applied research going back to when I worked in grad school at the Wayne State University Center for Urban Studies. And so when I came to Bowling Green, I got involved with the Center for Regional Development and doing a lot of similar type work, working on grant work, program evaluation, and the like. And when the state of Ohio had some money available to invest in trying to research infant mortality and some of the high rates we see and the racial gaps that we see in Ohio, Nicole and I got together and sort of brainstormed with some other folks at BG, but also some community partners involved. There's been a lot of work in Northwest Ohio and, developed some ideas to study the existing programming and supports that are here and how we could kind of collaborate to better understand the impacts that were being made and also how to continue improving the ongoing efforts.
Nicole, can you provide us with some background into kind of some of the work you've specifically been working on with this project and how it relates to some of your other projects with the CRD?
Yeah, sure. So this project is really at its heart a social determinants of health study, SDOH. And so social determinants of health are really social, economic, and community factors. And so at the CRD, that's sort of where we focus is, how do economic factors, community factors affect the well-being and opportunities available in our communities, and how do we enhance those opportunities? And so the work at CRD really nexuses with community health in a lot of ways, and we're continuing that work and expanding that work, looking at community health assessment, looking at community health improvement. And so this was a really great opportunity to sort of launch that research, which is, something that Justin and I both care a great deal about, and allowed us to work with some community partners that are also interested in this work.
You talk about the social determinants of health, and for folks who aren't really kind of familiar with that phrase and what all that entails, would either of you kind of care to talk more about some of the example? You've sort of touched on that, but to go a little deeper into some of those things and maybe particularly the kinds of examples that affect infant vitality and maternal health. Justin?
Sure. I mean, there's a whole range of them, but some of the basic necessities apply to health, right? We know that stable housing improves your health. We know that having access to healthy food and not being food insecure impacts your health. Stress levels, mental health, all of these kinds of things really impact how people's biological health is. And so there's really, even though we tend to separate them, there's really no separation between the social lives that we live and then the medical conditions that our bodies have. And so there's, this is part of a broader growing movement in health to recognize that money is medicine, just like, Tylenol as medicine sometimes.
Yeah, and in this particular work, we've come up against some distinct pieces of the SUH equation, including things like access to medical care, how you can actually get to the doctor. Transportation comes up again and again, and in fact, that's our third wave of this research is on transportation itself because of the understanding of the proliferation of that barrier to access. But things like being able to know where to go, and so technology and having connectivity to the internet and being able to access information, being able to understand what it is that your provider is saying to you and having comfort in that relationship. Those are all social determinants as well. And so one of the things that we have heard and found is that things like bias or perceptions of bias, women's comfort with their provider and feeling like their provider understands their life circumstances and the environment in which they live have distinct effects on the quality of healthcare and how they receive that healthcare.
And to their willingness to go seek that. I mean, one of the big findings from the first grant study was how many mothers had negative experiences with the provider in some context, whether it's their primary care provider, their OB, or their children's doctor. And so that has negative impacts for them even wanting to go back and see the doctor at all. Some people will switch providers, but there's a lot of difficulty in doing that and just time costs. And so, one of the other big social determinants of health is racism, institutionalized, in the structures in society. And particularly when we think about infant mortality, that's one of the big explanatory factors, if not the explanatory factor for why we see such significant gaps between particularly African-American mothers and other populations.
You've alluded to kind of the phases of this research project. Could you go back and walk us through what some of those previous phases of research have been, and then tell us a little bit more about this current phase?
Sure. The first study was called Stronger Pathways to Infant Mortality, and that was a program evaluation-based study of the Pathways Hub, which is a maternal infant care coordinated care system run through the Hospital Council of Northwest Ohio. These maternal infant care hubs are pretty, not popular, but there's quite a few of them across the country now. It's a model that seems to work quite well. It includes community health workers going out and assisting moms with accessing social resources, very SDOH focused. Our hub in Northwest Ohio at HCNO is one of the oldest in the nation. And so it's a very mature hub. And so it's a great sort of case study to assess the effectiveness of this methodology. So that's where we started. So that was phase one of the research. And so we did a lot of interaction distinctly with the participants, the moms who went to this hub for care, and then also the community health workers and the administrators of that system. The second one, which we're wrapping up right now, is leveraging patient-provider relationships to support infant vitality. And so this one is about that, as Justin was just saying, that relationship between moms and their providers and how that affects their ability to access care and the quality of care and that care-seeking behavior, right? So when they have a bad experience, how does that affect the way that they then engage in healthcare? And so we are working again with the moms, but then now with providers and hospital administrators, et cetera. And so phase three, which will launch in the spring
of 2024.
That's correct. And that one is transportation access affecting infant vitality, always infant vitality. That is our core focus, right, is how we make these moms and these babies' lives better. And so this one emerged out of both OTF1 and OTF2. That's what we call them in short. The funding is Ohio Third Frontier. Because again, that transportation barrier just keeps coming up again and again as one of the primary reasons that even when things are going well with the provider, even when the resources are being provided, they still can't get them because they can't get there. And we know that in this particular geography, public transportation is not really very robust. And so this is an experimental design that looks at sort of the current supports that are being provided in the context of public transportation, some market models, looking at like rideshare as an option, and then also looking at cash assistance as a third option. So this is our first experimental design, but one has led to the other. So the findings of Stronger Pathways told us that, provider relationships were important. Provider relationships told us that transportation was important. And so we keep moving forward.
Justin, Nicole mentioned the role of community health workers. Could you sort of explain what that role is and why they're so important as a piece in this study of maternal and infant vitality?
Mm-hmm. Yeah, so community health workers are kind of subset of what are termed in the medical community navigators, which has been a model that's been around for a long time and developed around cancer care, I believe, but people who are navigating a complex health system and a complex condition. And so the navigators were there to kind of act as a liaison to help people in various ways talk with specialists, but also literally navigate them through sometimes the Byzantine healthcare system. And so community health workers are similar in a way. They tend to be less specialized. A lot of the community health workers we spoke with actually were moms in the Pathways Hub and then graduated into becoming a community health worker. But basically what they do is act as kind of a liaison to social services. And so when moms come into the Pathways program, they do a risk assessment with the community health worker. And so asking questions about mental health, abuse, questions about housing, the whole gamut of those social determinants. And then when there's an identified risk, the community health worker help connect them to resources that will reduce that risk. And then the payment model set up around them kind of closing the pathway, connecting them to that resource. And then, the community health worker meets with them on a monthly basis, at least, to check in. And so there's kind of those formal supports that they offer, connect you to Medicaid if you need to sign up, that kind of thing. But they also offer a lot of informal support, which is one of the kind of the findings from our first study, is that a lot of moms describe their community health worker like an aunt or a mother or just a close friend, somebody that can offer the emotional support. And we know that sort of stress related to being a mom, but also stress related to kind of racism and the institutionalized pressures that moms are facing as well, that one finding was that they can help reduce some of that stress, at least according to the moms, that was a big impact.
I think about just sort of any of our own experiences with the healthcare system, right? It is not always simple and easy, right? And especially when you're talking about kind of connecting those with social services and other systems, it isn't just a matter of like your relationship with your healthcare provider. It's really kind of knowing when to ask a follow-up, when to need a referral, all of those things. And so what have you learned through this process and the different kinds of conversations you've had about how having that third figure of the community health worker, how that's helping moms to get the kinds of healthcare supports they need and to maybe communicate differently with healthcare providers than they would have or had prior to having a community health worker?
I think that's really a big one, actually. One of the things that we found is sort of one of those informal roles that the community health workers were playing was as sort of a health advocate and sometimes as like a partner in a sense, right? So sometimes the community health worker would be asked to come to some of the medical appointments with them to help them talk about things that were complicated. Sometimes there were cases where the experiences where some of the moms had gone to medical appointments, gotten information that was confusing or scary or in some way just disruptive and stressful. And the community health worker, one, helped them to understand, like, weed through that information to digest it and to, really sort of figure out what was going on. And in some cases then went to follow-up appointments and helped them ask questions. And though medical advocacy is not a formal role for most CHWs, because, there's a training aspect to that, there's a liability aspect, it is I think an important role, one that perhaps our research shows should be more robust or would be helpful to be more robust. Some of these moms as single women, maybe with small support networks or away from their family, whatever it may be, to have that other person to sort of even just talk through what they were experiencing was a really important stress reliever. Like Justin said, we asked them about stress because we know that stress is a big infant mortality risk factor. And so we know that the community health workers decrease their stress, but also we ask them about their feelings of hopefulness, their feelings of isolation. And community health workers significantly reduced feelings of isolation, helped increase feelings of hope. And so, we have a lot of stories from individual moms and from community health workers about that relationship and how central it is to the well-being of these moms.
Mm-hmm. I'm just thinking about one story. There was a mom who had health care through her husband, but he was laid off around the time of the pandemic. And so she's without health care, she's pregnant, and she's just unable to sign up for Medicaid just through the difficulty of getting into the system. I think they were overloaded at the time because that was a big thing that a lot of the mothers talked about, was just calling up to sign up for cash assistance, sign up for Medicaid, and they just couldn't get through, couldn't get to people. And the community health workers have a relationship with the people at the offices and kind of cut through some of the bureaucracy there and get that to them. And the mom said that was, all my stress almost went away when I finally got that call to find out that I was able to sign up for Medicaid. I've got health insurance that, is going to help with any complications I have with a pregnancy. So there's, big and small ways that they can make that kind of tangible impact.
Mm-hmm. Your project, obviously, we're alluding to this, that it is in part about racial equity in infant mortality and vitality. Can you talk a little bit about the kind of particular contours of Northwest Ohio relative to some of those national trends? Because we know nationally that, Black mothers are 3 to 4 times more likely to die during pregnancy or shortly after birth. And Black infant mortality is higher than white infant mortality. What are some of the kind of local dimensions of these trends?
Mm-hmm. Yeah, I was looking at the most recent report from the state of Ohio, and we see those gaps, white-black gaps in Lucas County specifically. That's where we focused our study. Since 2016 to 2020, we've seen slight increases in the infant mortality rate, even though we've seen nationally some slight decreases. And then we see that racial gap, with 2 to 3 times higher for African American mothers and about twice as high for Latina mothers. And so, I think that's one reason Ohio wanted to invest in this problem, is that Ohio is about the 9th or 10th highest infant mortality rate overall. And then Lucas County is one of the highest counties, around Ohio. Some of the other major urban centers and a few rural areas in Ohio are have certain zip codes in particular within them that are kind of hot spots for them.
So, Nicole, for you, how do you think the community health workers and stress reduction practices in particular might help reduce some of these disparities?
Yeah, I think that when we look at these disparities, we have to ask ourselves, what's underneath that, right? So we know that stress is the sort of manifestation, but what causes that? And so I think, as Justin has said, racial inequity is sort of at the bottom of this, and maybe economic inequity, right? And so, if we're seeing, particularly in hotspot zip codes, what you're seeing is basically racial and economic segregation. And so what the community health worker does is provide some, very tangible access to resources that are otherwise available, but where these moms who have sort of it's a layering effect, right? So they have multiple barriers to access, multiple hindrances, both socially, economically. And so having that person to help them navigate things that otherwise would be entirely overwhelming, right? It's one thing when a person, and I think that that's why you see sort of these stark numbers. It's one thing when you're navigating one stressor or one barrier. It's very different when you have 10 or 12. And so I think that that's sort of the underlying foundation, as well as the treatment with healthcare, which we've been discovering.
Yeah, stress is linked to low birth weight and preterm birth, and those are the biggest predictors of infant mortality. And so that's kind of the argument we're making, and some of the research we're trying to publish academically on it is that that's kind of a missing link, is that programs like this, if we can reduce stress, it doesn't get rid of the underlying causes of the stress, but it's a kind of a short-term solution potentially to help reduce some of that around the margins.
A mitigation.
We're going to take a quick break. Thanks for listening to the Big Ideas podcast.
Question. Answer. Discussion.
If you are passionate about big ideas, consider sponsoring this program. To have your name or organization mentioned here, please contact us at ics@bgsu.edu.
Welcome back to the Big Ideas podcast. Today I'm talking with ICS Faculty Fellow Dr. Justin Rex and Dr. Nicole Fifer about community health workers, stress reduction, and infant vitality in Northwest Ohio. Justin, you've talked about this a bit, that the project involves close collaboration with the Northwest Ohio Pathways Hub, community health workers, and mothers. Could you talk a little bit about the way community partnership is built into this project?
Yeah, I think, as we had mentioned earlier, Nicole and I have a lot of experience doing kind of community-based work and working with, government and nonprofit organizations and research organizations doing kind of applied work in the community. But, in this area, as we found when we were kind of putting together ideas for the grant, there's been a whole lot of local work that's been done, and they're already local experts. And so more expertise than us in terms of the infant mortality. And so we've, relied on them a lot is not only developing the grant, but then as key grant partners. And so, we, throughout the course of the previous 2 grants, we would meet every other week with folks from ProMedica, and from the hospital council. And so they're giving us input on how to design survey questions and what kind of questions we should be asking the moms, and just kind of a sounding board of local experts who understand the context better. And so we can bring in some academic knowledge, but then we're learning a lot from them, and they're learning some things from us as well. And so I think it's a good model, the model I like, where if we're doing research about the community, it's nice to have pieces of the community involved.
Yeah, I would agree. And I think one of the things that's really important to understand about this particular model is that the Pathways Hub itself, the coordinated care system, is a conglomeration of care providers, right? There are a number of different community organizations that are providing supports through this coordinated effort. And so in the first study, we also did survey those organizations that participate in the hub to just sort of talk to, get their feelings on its functionality, where the barriers are, what are the things that could improve, et cetera. And so, I think the bottom line with this research is that it is a community effort, right? There are a lot of different people at the table trying to make sure that these women get the resources that they need, that these children get the resources that they need. And so, like, in my head, I've kind of coined this new term. It's like we talk about the social safety network as or net, but for me, it's the social safety network, right? It's a group of people. And what we've learned from these community health workers in particular is that these are people who really dedicate their lives to trying to support these women and help them to get the resources that they need. And we've had some community health workers who were like pretty inspirational in terms of their level of commitment. There was one who said she was working on God's time. She was working a lot of overtime, no pay, because she wanted to support these moms. And I think you see that a lot in a lot of these organizations, and they're sort of undercredited for the efforts that they're making.
Nicole, I'll ask you this question first, but part of this study, you're combining quantitative and qualitative methods, right? So you're analyzing data, but you're also interviewing community health workers and talking to moms. What do you think is important about getting those stories as well as just sort of the aggregate data to evaluate?
I think it's precisely what Justin sort of said, is like, we know that the primary drivers of infant mortality are low birth weight and premature birth. Statistically, we know that. Everyone knows that. Doctors know that. But what causes those things, right? So there are some things that are very medically easily to triangulate: hypertension, things like that. Other cases, it's really hard to say what is the medical cause. And I think that's why that qualitative research is so important. If we didn't talk to the moms, if we didn't talk to the healthcare providers, if we didn't talk to the coordinated care providers, we wouldn't understand the nuances underneath that. We wouldn't understand the variable of stress and how that manifests in their lives. It's very easy to tell someone that they should just be less stressed, right? Reduce your stress. But when you're low income and you have multiple barriers to access and you're dealing with lots of social barriers or racial discrimination, stress is an integral part of your existence. And so to understand the nuances of that, the depth of that, we needed to talk to a lot of women. And had we not done that, we wouldn't understand it the way that we do.
Yeah, I think one of the things when we started reading some of the academic research on infant mortality, which has been studied very exhaustively, you can start doing comparisons and come up with a lot of key large-scale reasons why you see differences. So, the U.S. is much higher than basically any other industrialized country. And so we can look at healthcare spending levels and policy decisions that are made at the national level. And then you can compare different states in the U.S., right? And you can see those same differences. But one thing, at least researchers have said, is they don't know as much about kind of the ground level mechanism. So it's one thing to say, increase healthcare spending, expand access to Medicaid and things like that. But how do those actually translate into impacts, and what other kind of mechanisms can help reduce that? And so I think those policy things are really important, but we can also learn, as Nicole said, from talking to people about what's happening to them specifically and how they're being impacted by programs like this. So I think it's kind of a gap that we can fill with this kind of research.
Justin, based on the research that you've done now, what are some of the specific supports that are most impactful, that are most helpful to moms and their children?
Well, I think the hub model is based on key risk factors that moms face. And so those social determinants that we mentioned, those are known kind of reducers, or sources of reduction for infant mortality. But I think, one of the other big things that I think we're arguing with this research is that community health workers play a key role. It's not just in the connecting, that's important, right? Getting them connected to those resources, but also that kind of social emotional support that they can provide might be one of the ingredients in this broader mix of strategies.
Yeah, I'd agree. And I think that the social emotional piece is probably one, it's hard to quantify, right? It's very intangible in a lot of ways, but I think it's also easy to sort of miss in the equation unless you're really looking at relationships. And I think that the importance of having a support network, the importance of feeling supported, whatever that might look like for you, is a really important factor that has not really been unearthed as much as it should have, or maybe just there hasn't been an opportunity to. I'm not sure, but I think that that's one of the key things that our research has found is that social determinants of health are socioeconomic factors, they're environmental factors, but those environmental factors are also social factors.
How do you want your research to help make changes and help support at-risk mothers and reduce some of those disparities? What do you hope kind of happens with the research that you're doing?
Well, I think, one tangible local, thing is that we've talked with people, that we partner with at the Hospital Council, and they've said they've used some of the data, to help talk about the program and, when they're making their case for more funding. So I think that's one kind of tangible way that if we can add a little bit of additional data to help them tell their story better, to hopefully invest in a program that their data, but also some of our data shows that is making an impact. And I think, talking with some of the moms in this study and the one after, they felt that it was important. They really liked getting to talk with other moms because we did focus groups this time around where we may have 3 or 4 mothers in the focus group at a time. And so they never really been asked these kinds of questions about their experience with the hospital system. And so it felt like it was nice to, number one, just say it and say that out loud. But I think finding some ways to communicate back to the healthcare system as well, some of these stories. So we're going to be making some presentations through ProMedica's eBide Center, and hopefully some providers will be there, but also community health workers and the public to listen to some of those stories. And I think the data matters, but hearing those stories can impact providers as well. And even interviewing them, they said they do these trainings on things, it's kind of like a lot of workplaces do where they watch a web video for an hour and answer some questions so that can make you aware of some things you may not be aware of. But a lot of them said that some of the most impactful trainings they've done have been where they've learned kind of case studies or stories about patients and people. And so, we've got stories now that we could communicate or that moms can communicate in some way. And so I think developing some materials around that would be helpful at a local level to kind of show people the local impact of moms that you may be serving or moms like the ones that you're serving could be an impact as well.
Yeah, I think beyond, support for community health workers, proliferation of them, support for better and more in-depth training for medical care providers about bias, about equity, diversity, inclusion, about social determinants of health and how to talk to people, right, and providing them those stories. But I think the third piece also that we've talked pretty prolifically about is how do we create healthcare delivery systems where moms have that opportunity to be with other moms and to have some sense of community within that. And ProMedica, one of the centers we're working with at ProMedica, we've chosen them and they're continuing on with us because they are experimenting with this. There's a program, it's called Centering Pregnancy, where in addition to sort of the midwife care and the doctor care, they also then have like some cohort-based support groups sort of, but it's also like, okay, getting ready to have a baby and sort of all of the things that go along with that. But there's a sense of community there. And some of them moms that we've talked to really like it. Some of them have some complaints about it. But we know that there's something in there. There's something about the community space, the ability to have that sort of network of moms. As, the model probably can be tinkered with and improved or whatever. But those types of programs, I think, are really important. And I know that there's more happening every day. Queens Village, for instance, is a great example of this. It's a space particularly for women of color to come together and to share the pregnancy experience. And they provide doulas and resources and sort of in conjunction or in tandem with the Pathways Hub. We have one in Toledo. There's a really great one, robust one in Cincinnati. So we know that these types of models are becoming more popular and there's experiments happening, but really sort of putting some more legitimacy under that, right? Like this is not just a nice thing to have. This is essential. for moms, particularly moms who are facing socioeconomic barriers or racial disparities.
What advice would you offer to young people, students who are listening to this, who are interested in either kind of researching around the social determinants of health, or maybe are interested in becoming a community advocate or, participating in the system in some way? Any advice for how they might get started in getting involved with some of the kinds of things that you're doing with this project?
My email is jmrex@bgsu.edu, and send me an email if you'd like to get involved. One of the other pieces of this project is that we've had grad students through our Master's in Public Administration program involved in giving them some applied research experience that's been really valuable for securing jobs afterward. And we've had undergraduate students as well, some pre-med students of color who are interested in this problem and disparities. And so they've been involved with the research as well, helping with, transcribing some of the interviews or giving us input on questions. So we're continuing to do some of this research. So we've got opportunities. And if I can't give you an opportunity, we can connect you with other people in the area who are interested in doing this kind of work.
And BGSU does have community health, public health courses. We have public health program. And so if this type of problem or these types of questions are invigorating or exciting to a student, then maybe that's a career path for you, right? So we have training programs here. If you want to go to medical school, think about how can you do that community-facing piece, right? I think we need more young people who are invigorated to look at healthcare in a more social way, in a more dynamic way. So, we can get you started on research, or you can get started on the coursework, but there's lots of opportunity and there's lots of need. I've worked, as I said, we do more additional types of community health work. And one of the things that I did this semester was look at sort of the workforce problem around public health. And it turns out we have a real shortage. So if young people are interested in this work, get out there and join that workforce, because there is need. There's a lot of need.
Yeah, this reminded me of a story, but one of our Master's in Public Administration students, it's in our political science department. I run the program, so contact me if you're interested in that as well. But she was in our program and started working as a community health worker as she was finishing up the program, and worked there for a little while afterwards, and now works at an administrative and grants role at one of the clinics, where we interviewed some of the community health workers and moms that go there. So yeah, there's lots of opportunities locally for this kind of work.
Yeah. And one of our undergrads is now in a Master's of Public Health program and working at Queens Village in Toledo.
Fantastic. Thank you so much. It was great to talk to you both today. Justin and Nicole, again, thank you for your great work, and contact Justin if you are interested in getting more involved. Listeners can keep up with other ICS events by following us on Instagram, LinkedIn, Facebook, and YouTube. You can listen to Big Ideas wherever you find your favorite podcasts. Please subscribe and rate us on your preferred platform. This script was researched and written by Ahmed Bilal and Delana Harris. Sound engineering for this episode was provided by Brendan Akatura, Phil Beskid, and Marco Mendoza.